Mental health relative to the opioid crisis. I read a recent report that said 76 billion, with a B, 76 billion opioid prescriptions were handed out and fed to Americans over a 7-year course. That is at once a crisis and a crime that needs to be confronted by our law enforcement community, by our legislators, but even more so by us as a collective people. We need to wake up and challenge and not accept this overdosage and this over-medicating of our communities, of our society, and of our nation and country as a whole. I would like to see more of Dr. Gerard Klum's research come into play. I would like to see more of Dr. Guy Riekman's research come into reality and have these profound, notable professionals give them a seat at the table in terms of resolution and solution and how we can reverse this trend of opioid usage and abuse in our society. And we cannot take up this very sensitive subject, this very exacting, this very demanding and life-changing and life-taking subject matter without addressing the healthcare professionals that are the motivating and driving causes of the proliferation of opiates. You know, doctors and professionals in the healthcare community have a responsibility to be honest, to be sincere about the prescriptions that they give for the mental states that they intend to treat. And that's just not happening here in America. And we need to deal with that. There needs to be checks and balances in place in our medical system and our healthcare system as a whole to monitor the abuse, the usage of opiates in the midst of a pandemic, an epidemic that's not going to solve itself. In fact, I've never seen fire put out fire, but I have witnessed water extinguish fire. In other words, we can't get people off of their opiate addictions by simply substituting it with another dope. We need to have that conversation, and the chiropractic community needs to take a seat at the table so that we may research and discover other methods and remedies that brings about a permanent reversal and a permanent resolution to this opioid crisis here in America.